Hello everyone, WDHT Cares, and we are talking about the Affordable Care Act, which has also been known as the Obamacare Act. We are with Rob Cox, who is the Marketplace Navigator Coordinator in Garden City in the Community Research Department, who has also offices here in Dearborn Heights and in Westland. Rob, welcome to WDHT Cares. Thank you so for being with us today. Obamacare, also known as the Affordable Care Act, many individuals try to get online, try to actually apply for this Affordable Care Act, and there have been some glitches, and that's where you come in helping individuals try to get past the process.
Yeah, and so what we do is, so with the Affordable Care Act, that's the law that's in place for individuals to mandate that they have insurance. So we use healthcare.gov to actually help people enroll into the insurance of their choice, something that's affordable for them and something that best fits their lifestyle and family situation. So,
also, we talked a little bit about eligibility.
Sure.
Is that something that you are involved in, or do you just go through the process with individuals?
Sure. Eligibility is one of those things. So we go through an application process, and that's what our navigators who are, we have 5 locations. We actually sit down with you, and once you fill out your application, your application will tell you what you're eligible for, if you're eligible for any tax credits and other types of things. One of the things that's also nice is that we help everybody. So even if if they're undocumented, or if they don't have all the paperwork that they need, we really try to help make sure that people get the care that they need, and so that's important to us. So,
is there anybody that is not eligible in regards to applying?
Sure, so there are some eligibility criteria, and so because it can be pretty specific in terms of immigration laws and stuff like that, for questions like that, we would ask that you would give us a call at one of our centers and kind of discuss some of those issues.
So it's purely confidential conversations as well?
It's all confidential, so we are, we don't keep stuff on file on any of our, consumers that come in. We really try to make it as confidential and as informative and private, and really help people feel comfortable with talking about some of those really sensitive issues. Because we're not just talking about, we're talking about finances. We're talking,
absolutely.
some pretty heavy stuff.
Garden City actually went and applied for the grant to be able to help individuals actually apply, and you not only work with the Garden City residents, but you work with Westland and Dearborn Heights and various cities. So if anybody had a question, they would be able to give you a call for just assistance in applying, finding out through the process their eligibility, and also just getting on the computer and being able to physically apply for Obamacare or the Affordable Care Act.
Yeah, for just healthcare in general, and that's the important thing is kind of, if you need health insurance, one of our 5 locations, we have two in Dearborn Heights, one at the Berwyn Senior Center, Community Center, one at the Eton Senior Center as well. We also have one in City Hall at Westland, and one at Jefferson Barnes Community Vitality Center.
Is there an email address?
So we have email addresses for all of our navigators, but I can give you the phone number for each of the sites as well. And
great,
I think
we'll
we can put those as well. And so there's also a site in Garden City where folks can go for that application assistance as well. So
wonderful, wonderful. Well, thank you. I think what you're doing is phenomenal, and I know that there has been a lot of conversation about the Affordable Care Act, and it has been a little bit difficult for people to navigate those computer applications. So it's wonderful that you're there to assist and help.
And I appreciate that. And one of the things that I want to make sure we stress as well is the deadline for open enrollment is January 31st. So that's
that's very important.
Last deadline. To begin your coverage in January 1st, you have to enroll by January 15th. So the deadline's pretty quick. Okay. The other thing with that is, if for some time if you didn't have insurance through last year, there's a penalty for that. The penalty per individual is $695 in a family. a child would be roughly $350, and it could be up to 2.5% of your income for the year. So looking at a family of 4,
that's quite a bit.
Yeah, and you could probably get a pretty decent health, at least some kind of health coverage.
So really quick, if someone was not able to apply by January 15th and the cutoff date is the 30th, what happens after that?
So after January 31st. If you don't apply, if you don't have health insurance, you can still come talk to us, and we can try to figure out whether or not you actually qualify to be able to get into because there's certain life situations. So it really depends on the situation for each individual. And if you still need to get signed up, come talk to us, and we can try to figure something out, and we can go from there. The other thing as well is that even after open enrollment ends, we're still going to be here. Taxes are coming up, and people are going to have questions about the taxes. We can help out with that in regards to their marketplace insurance. Not general tax IRS questions, but only in terms of questions about their tax information for healthcare.gov.
Wonderful, wonderful. So if you need any assistance in applying for the Affordable Care Act, please make sure you contact the numbers up on the screen and also contact Rob Cox. Thank you so much, WDHT Cares, and thank you, Rob, for being with us today.
Thank you.